One of the fastest ways to PT burnout is when we start treating the condition and stop treating the patient. So many of us subconsciously shift to this condition or categorical mindset. We often label our patients as a shoulder patient, a low back pain patient, a knee patient. And although that's fine in reference in how we communicate, what's not okay is the response that our language then turns into poor actions. It turns into monotonous treatments because we give every single person with shoulder pain the same exercise. And as a result, we lower our standards as physical therapists. Everything goes through the motions, we have low standards, and it's the perfect recipe for burnout. So in order to combat burnout, we need to stop treating the condition and start treating the patient. When we understand what our assessment is telling us, we can then individualize and intentionally coach someone through movement to get a very specific outcome, right? So everything we start doing, from our assessment to our treatment to our outcomes, has intention and purpose. And when you can go throughout your career and challenge yourself to have intent and purpose behind what you're doing for every single patient, I guarantee you will not feel burnout. So let's run through an example so you can see how to put these principles into use. The first thing is our assessment. Ask yourself, what is the intent of the assessment? When we're in a burned out mindset, usually it's just a box we check and then we divert to our low back pain protocol or our shoulder protocol and treat everyone as if they're exactly the same. Well, what we're trying to do here is to remove that burnout. So what the assessment really needs to do is it needs to provide you clarity as to the starting position of the person in front of you. We're treating the patient, not the condition. And so if you're not familiar with assessments that do that, I will go ahead and leave the Performance Redefined course in the link below, where you can learn assessment strategies to then treatment to then plan of care. Now, that doesn't have to be your model, but the bottom line and the main principle is that we need a model and a framework that helps us understand the assessment in a way that allows us to paint the picture where to go, right? If we're burnt out and we just check the box, it's not even worth the time, right? So the first things first, find a model for it. Your assessment. Let it be your guide so that you know where to go next. When you can do this, it's fun, it's purposeful, it's intentful, and you will find a lot more meaning out of your assessments to then carry that forward to your next step in the process. So our next step would be, what exercises do we choose? Well, in the burnt out way, the exercises are pre-selected, right? We are treating a low back pain patient. They then do X, Y, and Z exercise because that's what I do with everyone, right? But when you start to treat the patient, your assessment then tells you exactly what to do. For example, if you're working with someone that has low back pain and they have an anterior pelvic tilt and their ribs are flared and they have a ton of extension, we can give them very specific exercises to get the rib cage down, to get them to go into more of a posterior pelvic tilt, the opposite direction, to start to get them out of pain. But if you're working with a patient that has low back pain and they're in the opposite motion and they're more hunched over, they're rounded, we want to start to give them more extension exercises, right? And so we're trying to increase their movement variability, but we can never do that if everyone's given the same exercise, because out of the two scenarios we just said, if you gave them the same exercises, one may have a favorable response, and one is never going to get out of pain. We're actually getting them stronger in their dysfunctional pattern, right? So understanding the assessment then tells you exactly what you need to do with exercise selection. And again, when you coach the exercise, you can use specific coaching cues and modifications that are specific to that patient. And again, the point that I want to keep driving is that that is done with intent. When we can perform our job with intent and purpose, burnout will be something that you completely forget about, right? Because you're making a difference. And ultimately, a lot of us got into this field to make a difference. So we need to be intentional with the exercises that we're choosing. The final step would be to reassess. Now, in the burnout mindset, there's usually no reassessment. The person does their exercises and they go home. How do you know if that worked? How do you know if that's the best for that patient? Well, when we reassess something such as, did this person improve in their hip internal rotation based off the exercises I gave them? Yes or no? If it's yes, great, we want to keep that. If no, we need to change it. What's changing? Intentional exercises. right? And as we keep refining this, that is going to continue to get the patient closer and closer to their goal. Why is that important? Because when you can truly attain a goal for a patient and get them out of pain, you've changed their life. And I promise, when you change someone's life in a positive way, you are going to feel like you have purpose. This purpose is driven by intentional actions, which removes burnout. So again, the bottom line, assess, coach, reassess in an intentional and purposeful way, and burnout should genuinely be a thing of the past.